Ladies and gentlemen, if you've ever seen somebody who you loved and who was vibrant and active, who had a stroke and suddenly their speech is slurred, they can't stand up as well as they should, they have a hard time remembering things, it is tragic. But it's happening to millions and millions of people in this country. So we've got somebody who's an expert on how to prevent these things. And so would you please welcome to the 700 Club neurosurgeon and author, Dr. Russell Blaylock. Doctor, thank you so much for being here with us.
Thank you.
Good to have you. We mentioned this aspirin thing. If you think a stroke's coming on, does an aspirin do you any good?
Well, it would if you were sure that it was a ischemic type stroke, that is, one that's a clot. But if it's a hemorrhagic stroke, it'll actually make it worse.
All right, tell us the difference. You got ischemic and you got hemorrhagic. What are the difference?
Well, the ischemic is an interference with the blood flow to the brain, for instance, a clot in the vessel or a closing off of the vessel.
All right.
If you take an aspirin, that thins the blood, so what little blood can get through a lot easier.
Okay.
So it'll help it. But if you've hemorrhaged inside of your brain, either deep in the brain or on the outside, as we see in an aneurysm, then taking aspirin thins your blood, and it makes it a lot worse, particularly for the surgeon if he has to operate on you.
What do you do to prevent these things? They're so tragic, and you've had patients, and I've had friends who've had strokes, and it is just terrible to see a normally vibrant person suddenly with slurred speech, the side of their face is paralyzed. What do you do for them?
Well, I've done some intensive research on the cause of strokes and cause of arteriosclerosis.
Right.
And what we've discovered is that it's not what most people think. It's not eating high cholesterol and high-fat diets. It's the fact you have chronic inflammation in the walls of your blood vessel. The leading cause of that is abdominal obesity and low magnesium levels.
Come on. You mean the big belly leads to stroke? Is that it?
Right, because there's certain types of fats, special fats in this inside fat in your abdomen that produces inflammatory chemicals called cytokines.
All right.
Everybody who has advanced arteriosclerosis has high levels of these chemicals.
Okay.
When you reduce that fat, even surgically, you surgically remove it, it goes away. The heart attack rate drops very low, strokes, MIs, hypertension, sleep apnea, all these things start disappearing.
You mean the guy with the, little, whatever they call those, the cannula, plastic surgeon doing liposuction, that will reduce the risk of a stroke?
Well, that's subcutaneous fat. This is fat deep in the abdomen.
Oh.
So when they do surgery where they open up your abdomen, they remove the fat inside there, 80% of hypertension will disappear.
Well, that's pretty radical. Is that tummy tuck kind of stuff you're talking about or not?
Well, it's even deeper.
Even deeper?
You go inside the abdomen.
I don't think many people, you're talking about major surgery. Well, short of surgery.
Well, this is what exercise does.
All right, what?
When you exercise, that fat disappears first.
Yeah?
And so this is the beneficial effect of exercise, is you lose that inflammatory producing fat.
What's the exercise or series of exercises you recommend, or do you recommend?
Well, I think moderate weightlifting is the best.
Do you?
And the results are coming out that that's what our research is showing, is that when people do weight exercises, they actually burn a lot more fat, burn a lot more carbohydrates, and this intra-abdominal fat, this visceral fat, starts disappearing. And then all of their diseases start going away because
you're not talking, I mean, weightlifting would involve, it's like bench presses and things. Are you just talking about stuff having to do with your lower body?
Well, it's everything. It's light weights of the arms and over the head, and bench presses and leg lifts and all of these things.
All those things.
They burn all of this fat up very readily.
Well, what about the foods? Some kind of healthy eating. What do you recommend?
Well, we know the diet makes a lot of difference, but it's not eating cholesterol that's the problem. It's that you're not getting enough vegetables.
Yeah?
The vegetables have chemicals in them that are powerful anti-inflammatories, powerful antioxidants, and they can actually reverse the arteriosclerosis. And in animals, it's almost impossible to produce arteriosclerosis if they're taking high concentrations of these vegetable products.
What kind of vegetables?
For instance, kale, collard greens, mustard greens, celery, broccoli. All of these things are powerful inhibitors these fatty chemicals that are producing this inflammation.
The problem is our women, for example, are working, men are working, and the idea of sitting down to dinner with cooked vegetables is kind of a thing in the past. Do people eat much of the fresh vegetables anymore?
Well, it's very rare.
Yeah.
Because they're canned vegetables if they get them, and they're usually not eating any more than 1 or 2 servings a day.
Yeah. How many should you have?
Absolutely nothing.
Nothing?
Until you reach 5 servings a day, you're getting no benefit. It's recommended 10 servings for everybody under 50 and 12 servings over 50.
Wait a minute. Carrots, broccoli, kale,
mustard green,
collard. You got to eat 5 of those a day, and maybe double. I mean, 10 of something else, cabbage.
Well, you can eat 10 servings of all of those.
Yeah, all right.
And when you reach that level, the antioxidant, anti-inflammatory effects are tremendous.
Yeah.
The reductions in heart attacks, strokes, arteriosclerosis, cancer go down tremendously.
It seems so simple.
It is simple.
Yeah.
But the trick is, it's very hard to get the chemicals out of the plant. And that's because they have cellulose around their cells, and we can't dissolve it.
So what do we do?
So it means you either have to cook it and break it down,
Right.
but we throw the fluid away, and that's where all the chemicals are that are healthy.
All right.
Or you've got to mechanically breek it down by blenderizing it.
We used to have something in the old days called pot liquor. That was you know, you'd cook the kale and stuff and whatever, and it was that you know, that used to be very choice in the old days of the South, and that was probably the best part of the vegetables.
Well, it was. When you would drink the pot liquor, you're getting vitamins, minerals, particularly magnesium.
Yeah.
Magnesium is the most important in preventing heart attacks and stroke, more than anything else.
Unbelievable. Any amount? I take a whopping dose of it myself, but how much would you recommend?
Well, the average person should take about 1,000 milligrams a day in divided doses.
Well, that's what I take. Okay, I guess I'm average. Well, anyhow, well, what about, you got all these things in front of you, especially like this fish oil here, super DHA. This is fish oil, I guess. What do you recommend to supplements? Is supplements going to help anybody?
Well, you need extra supplements because our foods are so terribly depleted now because of farming methods.